And we are joined now by the nation's top doctor, the U.S. Surgeon General, Dr. Jerome Adams. Dr. Adams, good morning to you, sir.
Good morning, Savannah. How are you feeling?
I'm feeling well enough. Thank you for your kindness in asking. I want to ask you, do you feel like people are getting the message here? You know, we still see people out and about. You had 3 states holding votes yesterday. Do you think people are sensing the urgency?
Well, I think we're starting to turn a corner, and people really are. It's because it's starting to affect people who they see and know. I have a 15 and a 14-year-old son at home, and they don't care what dad says, even if dad is the Surgeon General of the United States. But by golly, they know that Kevin Durant just got diagnosed with the coronavirus. And they're taking it seriously. And you're modeling the behavior that we want people to model. We want them to understand that, look, chances are you don't have coronavirus. Chances are, if you do have it, you will recover. Based on the Korea data, 99.3% of people recover. But what we don't want to do is have you or anyone else out there spreading it to people who are at higher risk.
Absolutely. These new CDC guidelines that were announced this week say advise no gatherings of more than 10 people for the next 15 days. You've said we can do anything for 15 days, but give it to us straight. Isn't this going to be longer than 15 days? How long do you think people should expect to be at home, essentially?
Well, what you're talking about is our 15 Days to Stop the Spread initiative. We're telling people that we really want them to avoid gatherings of 10 or more. We want them to avoid any unnecessary travel. We want them to work from home if at all possible, or not go in. And the reason why we framed it this way is because when we look at the data, our numbers are where Italy's were 2 to 3 weeks ago. So we really have a choice to make right now as a nation. Do we want to go the way of Italy and see our numbers increase rapidly? Or do we want to go the way of South Korea and China, who aggressively leaned in the mitigation measures and were actually able to level off their peak and are now seeing significantly decreased numbers of cases? We really feel like if we can get America to all pitch in. Yeah. We feel like if we can get America to all pitch in for the next 15 days, we can flatten the curve, which is a term that you've been hearing a lot, not overwhelm our healthcare systems.
So
and
15 days is enough?
15 days is likely not going to be enough to get us all the way through, but we really need to lean into it now so that we can bend the curve in the next 15 days. And at that point, we'll reassess.
Okay. Okay, let me ask you about a new study. It was published just yesterday in the New England Journal of Medicine, and it found that the virus is somewhat airborne, that it can stay suspended in the air for up to a half hour before descending and settling on surfaces. I don't have to tell you this is different than what the World Health Organization has said, that it's not transported through the air. What's your best information on that issue?
Well, this is a new virus, and we're learning more about it every day. I talk to Tony Fauci multiple times a day, and he and Dr. Birx, and the best virologist in the world, still believe the primary mode of transmission for coronavirus is by droplet, which means, again, social distancing is going to be the most effective thing you can do. When you talk about surfaces, that's why we really emphasize the importance of washing your hands and constantly cleaning surfaces. If we do those 3 things, making sure we're cleaning our surfaces, making sure we're washing our hands, and making sure we're staying 6 feet away from people, that's how we will most protect ourselves from this disease.
Dr. Adams, let's talk about testing. I don't think there's much dispute that the CDC was slow to get testing going, that there have been delays. I mean, even now we see lines, people trying to get the test, even though they're more widespread now. We still have only tested 59,000 people in the entire country when South Korea was doing 10,000 per day. The question is, what is the status now of testing? Are there enough tests out there, and are they being processed in a timely manner?
Well, a fair question, Savannah, and I really feel like we've turned the corner on testing this week. It's important for people to know the CDC stood up a test for this in a week, but the CDC was never equipped, staffed, or intended to provide testing for hundreds of millions of people. We were always going to rely on the commercial market and the private industry, and now with the FDA approval or emergency use authorization for a high-speed test last week, you're seeing testing increase. And what American people really care about is, can I get a test in my community? You're starting to see that. The small rural community where I grew up in offer drive-through testing this week. We're starting to see more and more people get testing. But here's the important point. You should not change your approach to mitigation measures based on a positive or a negative test. You could test negative and still be early in the incubation period and still spread coronavirus. So if you're sick, just like you you did,
Yes.
stay at home. We should be acting as if we have the virus, as Tony Fauci says, so that we can protect one another.
Real quickly, because I'm almost out of time, but I do want to drill down. The big question and the whole reason we're trying to flatten the curve and slow this down is so that our healthcare system can manage the patients who do come in and are very sick. Are you confident we have enough respirators and ventilators to help patients and protect our frontline healthcare workers?
Great question. When you look at modeling, again, you've got curves that look like Italy and curves that look like South Korea. The best way to not run out of ventilators or PPE is to make sure you drive down demand so you don't need them. And that's why, again, we're leaning into the next 15 days. Now, I want Americans to know we have a national strategic stockpile. We're working with public and private partnerships to increase production, but that's on the supply side. If our curve goes the way of Italy, and there is every chance that we could run out of devices. And that's why it's so important that we lean into these mitigation efforts now, drive down demand, flatten that curve.
Some have suggested invoking the Defense Production Act right now to ramp up production of ventilators and respirators and this equipment just to make sure. Maybe we'll never get there, but wouldn't we rather be prepared now?
Well, everything is on the table, and the president and the vice president have been in contact with industry on a daily basis, trying to ramp up that production. Right now, as Surgeon General, my job is to talk to the American people, and what the American people can do is really drive down that demand by staying at home, washing your hands, social distancing.
Yeah. Dr. Adams, I got the message. Thank you so much for being with us this morning. We really appreciate it. I know it's a busy time.
Thank you. Another important point, you can still go out and give blood. We're worried about potential blood shortages in the future. Social distancing does not have to mean social disengagement.
Yeah, I'm glad you mentioned that. We definitely want to make sure they still have the supplies they need. Thank you, sir. Appreciate it.
Thank you.